Hey guys, Michael Kummer here. In today's video I'm going to show you how I've injected myself with ozone. That's right, I did an ozone IV. I pulled blood from my body, injected it or enriched it with ozone gas, and then put it back in. And I've done this using an ozone generator from Simply O3. Now before we get started, make sure you subscribe to this channel and you click on the little alert button so you get notified when I do more stupid stuff like this. I also want to mention a couple of important things. Number one is a medical disclaimer. Nothing of what I tell you or show you in this video should be considered medical advice. I'm not a doctor, I'm not a medical professional whatsoever. I always recommend consulting with a knowledgeable medical professional before you do anything that you might see or hear me say on this channel. And it certainly implies to doing IVs. The second thing is that I'm an affiliate of Simply O3. So if you use my discount code or affiliate link, then what I've done in the description to purchase one of those devices, I might get a commission. That doesn't change my editorial integrity, but I wanted to let you know. But most importantly, don't do this at home unless you know what you're doing. Now, before we jump into the actual IV, and I'm going to show you how that's done, also make sure you look at my blog. By the time of this video gets published, I likely have an in-depth review of the scientific evidence behind ozone therapy and the different types of ozone therapy modalities you can use, because the IV is most certainly the most invasive way of doing it, even though it's a systemic treatment, but there are other and potentially easier and better ways that you could do at home. All right, so here we are. I already got the line prepped. It's hanging up here with the saline. Now we're gonna get some ozone. My generator is already running. I can smell it. So we're gonna prep this syringe here with 60 cc's of ozone. Let it just fill it up here by itself. All right, that is it. We leave that in here. I can turn off the machine. This is our ozone. Next, we're gonna preload this syringe here with heparin to prevent the blood from clotting. 0.1 cc's, very little. That is that.
And again, as a reminder, don't try this at home. None of what I show you is medical advice. It should be considered medical advice. I'm not a doctor.
All right, and next we're gonna ask for our lovely assistant to help them with drawing 60 cc's of blood into the syringe. Okay, there is blood. That's a good sign. Now, so, first time around, didn't work. I think I've never used one of the suckers before. So that's a learning exercise, that's okay. We're gonna try it again. Just have to put it in a little bit more. I don't think it was in for enough. All right, so now that the blood is in the syringe, we're gonna go ahead.
You're definitely a nurse practitioner here to assist. Unsqueeze the line here, please.
All right, so we unscrew the syringe. If you hold the syringe, I'm gonna hold the blue thing and you can twist the syringe. All right. All right, coming off, let's let it bleed a little bit. Okay, I'll plug it in. Okay, all right. So you can see it's totally worth doing that all at home. Alrighty, so now we have the line in. Now let's get that started. All right, so we're now gonna put the blood back in. Gonna inject our beautiful blood in here. Okay, the blood, bloop. And then we're gonna inject the ozone. And we should see the blood changing color as the ozone reacts. So, All right. And now we wait. Whew. Now, while this is finishing up, let's talk about ozone therapy in general, the different types of ozone therapy, because the one I chose here to show you in the video is arguably the most invasive one. There are different ways of how you can leverage ozone therapy to achieve many of the benefits that I've discussed in my blog post, so check that out. But besides, well, let's maybe talk about systemic versus local treatments real quick, because an IV ozone treatment is systemic, meaning that it targets your entire body, hence the name systemic. But there are two other options of systemic treatments that you can choose that are significantly less invasive. One is anal insufflation. So you basically stick a soft tube up your butt and you get ozone into your body through that route. And there is also vaginal insufflation. So if you have a vagina, that is an option that is arguably maybe the most comfortable, the least invasive one to get a systemic treatment. The reason why I chose the IV route is because I think it's easier on video than showing you the other option that I have, which is the anal insufflation, or rectal insufflation, I should say. But all three are systemic, so ozone would reach, or the ozone metabolites would reach your entire body, and you can treat different areas in your body by going that route. But there are also localized treatments, like for example, we've used ozone therapy to help my daughter with ear pain. She had maybe an ear infection or maybe something else, but definitely ear pain for days that wouldn't go away with other home remedies. And so we used ear insufflation, where the ozone gas would basically just go into her ear canal and do its thing there. Ozone is very reactive, so it oxidizes quickly and it reacts with anything that it finds, including pathogens. And that's the reason why ozone is effective. And it's also the reason why, for example, my cold plunge uses ozone to sanitize the water, to keep the water clean, because it's kind of a disinfectant. It kills bacteria on contact, it kills pathogens on contact, and so that's the idea behind ozone. But again, if you want to learn more about the benefits, check out my blog post. In this video, I simply wanted to show you what it takes to do such a treatment if you want to go the IV route. Some of the components that I've used that I haven't really talked about throughout the video is an oxygen tank. I have that down here. I'm going to show you a picture then. Here is the ozone generator from Simply O3 that I'm using. And silicone tubing. Most of it here is silicone, because ozone can react with tubing material, so it's important that it's silicone based, and all of the tubes here are silicone. And I used the standard IV equipment, basically a couple of different needles, like 18 gauge needles here, to get blood out. Heparin to prevent clotting. That was really the most important factor, or the most important thing here. If you want to do the IV route, you need heparin to prevent the blood from clotting. And saline, 250 cc's that I've used. It's hanging up here on my very professional hook that we also use for a plant. And that's pretty much it. The IV is almost done here. Probably have a couple of, maybe less than 5 minutes left, and we are done. All in all, it took maybe an hour from start to finish, prepping everything, setting everything up. Again, if you want to go the rectal insufflation or vaginal insufflation route, it takes significantly less time, significantly less invasive. And with that, we're going to wrap it up. If you like this video, give it a thumbs up. If you didn't like it, let me know in the comments what I could have done better. Until next time.